Nutritional and hormonal support are crucial to the rehabilitation process. When the body is unable to absorb proper nutrients from food, it begins to mine those much-needed nutrients from other sources, such as your muscles. The muscles are a reservoir of vitamins, minerals, and amino acids. This loss of muscle mass is called sarcopenia. Maintaining muscle mass with nutritional and hormonal support is an area not yet considered in the current stroke rehabilitation treatment process. What you're about to see is a personalized treatment protocol designed specifically for John Michael Knight based on his unique metabolic deficiencies.
Hello folks, my name is Russ Scala. We want to update you on part 2 of the John Michael Knight protocol. As you know, in our first video we talked about how we pulled our team together, how we put together all the advanced research. Well, now today we're going to talk about some of the advanced testing that we did on John Michael that isn't offered anywhere in the stroke rehabilitation market. What I'm going to try to do is talk about this testing in a way everybody can understand it. So I'm going to start at 60,000 feet and then I'm going to come down on the cellular level. Folks, what we're going to look at is we're going to look at mitochondria. Mitochondria is the energy batteries in every cell in the body and how the mitochondria are going to be important to John Michael's rehabilitation. Okay folks, I'm going to start out with a basic visual for everybody. This is going to be a cell in the human body. The battery that I'm putting in here, the 2 batteries, this is considered the mitochondria. This is how we create energy. Okay, we create ATP or energy in every cell of the body, depending on how many mitochondria are in each cell. Now, John Michael's brain is completely different from, say, an elderly person that had a stroke, because John Michael was an athlete. Now, John Michael Knight, because he was an athlete, he has more mitochondria on a cellular level. We believe if we test the mitochondria, which I'm going to show you what we did, we exactly tested John Michael's mitochondria. This has helped accelerate the rehabilitation of muscle mass as well as brain chemistry. Now folks, the batteries that were in that water bottle that signify the mitochondria, this is the mitochondria on a cellular level. This is actually what happens, how we create energy out of the food we eat. And one of the first things we found out when we did the advanced testing on John Michael was, believe it or not, what was going into his feeding tube was too high in maltodextrin and it was causing brain inflammation. So let's look at this. To create energy on a cellular level, proteins, carbohydrates, and fats are broken down. In John Michael, we measured here what's in red, and we replaced the nutrients that are in blue, the B vitamins, the alpha-lipoic acid, the amino acids. We could test and correct the deficiencies on a cellular level that will assist John Michael with his rehabilitation process. Now, the new research says that fats function on the mitochondrial level more efficient than carbohydrates, and we found this because the new research with Dominic D'Agostino out of the University of South Florida says that the brain utilizes fat more efficiently than carbohydrates. When you use carbohydrates, we found markers in John Michael's lab results that showed there was brain inflammation going on because of the high maltodextrin solution that was going into his feeding tube. So that was great. So now we wanted to shift what he was getting to eat of more of a higher fat solution, because the higher fat in his diet will help his brain function better. And that's an area that nobody is talking about in neurology, folks. That's an area that's pretty powerful, and I think will change the landscape of neurological treatment. John Michael, this is for you, buddy. From athlete to athlete, we're going to increase your performance. This is what we found, okay? Right in this area right here, we found out that you're not breaking down carbohydrates, so this is why the high-fat diet is going to help you. Right now, on a cellular level, the carbohydrates that you were getting were not being broken down, and we detected that in your test results. We also found out here your neurological system, your neurotransmitters were a little low. After all the stress that you've been through, obviously, it lowered some of your feel-good chemicals in your brain. This last part here is your intestinal tract was out of balance. Because of the high carbohydrate solution you were getting caused an imbalance in your intestinal tract. And John Michael, your intestinal tract is considered your second brain. And in order to get your body to resonate, you are not what you eat, you are what you absorb. So the food that you eat, once we get your intestinal tract back in balance, you'll be able to pull nutrients out of food more efficiently. Now, would you rather pull nutrients out of food, carbohydrates, fats, and proteins, vitamins, and minerals out of real food, or synthetic vitamins and minerals? This is the area that we found where your intestinal tract was out of balance, and that's what we're going after right now. So our next step is we're going to prevent muscle wasting. Okay, Dr. Tracy Rhodes went over all the research that we put together, and now the next level we're going to go to is going to prevent muscle wasting when you go into the rehabilitation process. Because if you're deficient when you're going through rehab, your body's going to mine nutrients out of your own muscle. That's why with this testing we want to put a shield up for you. Okay, make sense? Okay, as I mentioned, you are not what you eat, you are what you absorb. These markers here, these high indicating markers, says that there's a bacterial imbalance in the intestinal tract. In order to speed the rehabilitation process, we want to make sure that the intestinal tract is clear of all bacteria and all yeast overgrowth. A lot of rehab, they don't understand that you got to cut the carbohydrates out of the diet. And in order to get the body to resonate and make it stronger, we have to clean up the intestinal tract. And this is what we're going to focus on here using this indicator. Now, folks, this came from one of the leading research labs in the United States. This is why this treatment protocol is only customized for John Michael. Folks, this part is pretty complicated, but thanks to Dr. Arnaldo Isa, a neurologist, thanks to Dr. Ira Goodman, who came and sat down with me and walked me through some of the latest research, I shared with them this testing, and we collaborated a few years ago, and that's sort of the evolution of this. Now looking at John Michael on a cellular level with his neurological system, here's some of the interesting things that we found. This area right here detected low dopamine levels. We have serotonin and dopamine in our brain, our feel-good chemicals. When serotonin and dopamine are low, it can lead towards mood swings, depression. On a cellular level, we're finding out that John Michael's dopamine levels are low, which is this is part of the stress that he's been under since this incident's happened. So helping us be aware of this allows us to plug in more treatment protocols that will help him with his mood and help him stay motivated while he's going through the rehab process. So understanding that these neurotransmitters are low and the stress that he's been under, we could help plug in interventions. Secondly, this marker right here, quinonate, this is a brain inflammation marker. So because of his high carbohydrate diet, because what was going into his feeding tube earlier in his rehabilitation process, we found an inflammation marker in his brain that was causing brain inflammation. So this research from our research lab lets us know that we have to change the diet, we have to change the food, we have to elevate to a more high-fat, high-protein diet so we could avoid brain inflammation. And what a lot of the neurologists don't realize, and it's not their fault, they don't understand how food affects the neurological system. When you eat too many carbohydrates and you elevate your insulin and you elevate your blood sugar levels, it creates a lot of smoke in the brain. And John Michael doesn't need any smoke in his brain when he's going through rehab. That smoke is a metaphor for free radical damage. Folks, another area we could test with these brilliant people that I surround myself with, we're able to test DNA. And we're able to measure DNA damage on a cellular level. And there's a difference between genetics and epigenetics. And just let me tell you, people say and doctors think if you have a genetic susceptibility to a disease, you're going to get it. But that's not true. If you think about it, genetics cocks the trigger and your behavior and your environment pulls it. Okay? For instance, if you have a genetic susceptibility to diabetes, and if you work out and exercise and eat right, then you won't get diabetes. But if you have a genetic susceptibility to diabetes, as an example, and you're overweight, you eat bad food, then you're going to end up with diabetes. So remember, there's genetics and there's epigenetics. That's your behavior. So in this situation with John Michael, we measured something called 8-hydroxy-2-deoxyguanosine. And that's basically a big word for saying we can measure his DNA on a cellular level right here. This 8-hydroxy-2-deoxyguanosine will let us know that is his antioxidant level up? Is he damaging his DNA with the rehabilitation process he's going through? And in this area, everything is fine. So on a cellular level, DNA-wise, we're looking good, John Michael. Folks, one of the areas that we're going to look at with John Michael in the next part of this treatment protocol is muscle wasting. Muscle wasting or sarcopenia is an area that the current stroke community, the stroke rehabilitation community, is not looking at. We feel we're on the tip of the spear in this area, and what we're going to design for John Michael in the area of preventing sarcopenia will impact people across the world. This is an exciting time. The areas that we want to look at is nutrition, hormones, intestinal tract, because as John Michael goes through the rehabilitation process, if he's in a nutrient or hormonally deficient state, his body will mine nutrients out of his own muscle tissue. And folks, that's what we want to avoid, and that's what's currently not being done right now.
Like osteoporosis, sarcopenia is a multifactorial disease process that may result from suboptimal hormone levels, inadequate dietary protein, lack of exercise, oxidative stress, inflammation, and other nutritional imbalances.
Okay, folks, this part, we looked at the nutrition, we looked at muscle wasting. Now we're going to look at the brain chemistry, something called neurogenesis, synaptogenesis, the development of new brain tissue. And folks, let me just tell you, this is a very exciting time right now. With what's happening to our war vets with brain injuries, with the NFL, the movie Concussion coming out, there is a race to have better treatment protocols for brain injuries and strokes. And we happen to be in touch with the best people in the country. And that, I mean, these are the people that make us all look good. The areas that we want to consider in developing new brain tissue with this testing I'm going to walk through is something called BDNF, brain-derived neurotrophic factor. That's the miracle growth for the brain. Vascular endothelial growth factor is the veins and arteries that support the growth of new brain tissue. We know that when somebody has a stroke, that their whole body and metabolism changes. The muscles don't get used, the electrical pathway, even the neurons on the muscular level are changing. So we want to put a shield up, we want to correct deficiencies, and then we want to implement a hormonal strategy to impact neurogenesis, synaptogenesis, as well as protecting the muscles and maintaining muscle mass. So let me sort of walk through it basically. Any type of acute stress shuts off everything like a clock. Elevated cortisol from the stress response lowers all our hormonal levels. So if you go through surgery, if you go through trauma, if you're going through rehabilitation and your cortisol levels are elevated, it's going to suppress testosterone, it's going to suppress growth hormone, and something called IGF-1. Now in the first video, we put all the research together for John Michael Knight. My team came together with all the doctors. There was about 15 people that did that. They did a brilliant job. We put together a booklet that focuses on all the latest research from around the world on how IGF-1, when it's elevated, can accelerate the healing process. John Michael's an athlete. His brain is completely different from everybody else's. I know nobody considered that. We found inflammation and imbalances in the intestinal tract and in the brain chemistry. I know nobody found that either. So now if we get IGF-1 up and we maintain growth hormone, if we maintain testosterone levels, if we maintain thyroid levels, this is a multifactorial approach to accelerate the rehab process of any stroke patient. This is a multifactorial approach that is not being currently done in any of the stroke rehabilitation markets anywhere in the US. And again, we're not pointing the fingers, we're not saying we're better. All I'm saying is our small group of motivated people came together and created something that's never been done before, okay? And this, again, this puts us on the tip of the spear. This is where we're moving with John Michael in his next level of treatment protocol with Dr. Tracy Rhodes, who took the time to evaluate everything, and that was amazing. Because, you know, as you know, most of the physicians that meet me and want me to develop something, they get a little nervous, which is to be expected. There was about 15 people and 4 physicians overall that helped put this treatment protocol together. So folks, it wasn't just me. I sort of just pulled it all together. Folks, I've been involved in medicine for 40 years. I'm just as fascinated today about the physiology I was when I was a kid. America is 37th in healthcare. I don't know how that happened, but I want to change it. This is why I started the Russ Scala YouTube channel, because I want to educate people like yourself to ask the tough questions and to make decisions and to get out of the railroad tracks when something bad happens to a family member. Thanks and stay tuned.